Here is a vein. The vein has three layers of tissue. The outer connective tissue, which is called tunica externa, tunica media in pink, which is made up of smooth muscle, and the tunica interna, that is shown in blue, which is made up of epithelial tissue. The inside of the large veins also carry valves. That's what you see in the center. These valves are very important because they help to prevent backflow of blood. The veins always carry blood back to the heart, and so there might be some backflow of blood, especially when you're taking blood from your feet all the way to your heart. There is another problem when a person has a job where they have to stand for long periods of time, and that problem is varicose veins. So if you are a dental hygienist or a hairdresser and stand for long periods of time, then varicose veins might be a problem because these veins are become very tired, and the treatment given is support stockings. Support stockings help to increase the blood going back to the heart, and we call this movement of blood back to the heart, we call it venous return. If you are sitting for long periods of time or laying on the couch for long periods of time, your venous return is much lesser than if you were walking. So what happens is that you get less circulation, and so you feel worse. The problem here is gravity, because when you're sitting for long periods of time, the blood has to move back to the heart against gravity. The way you can fix this is by elevating your feet or by exercising, which is the best thing you can do for venous return. There are 5 mechanisms that help to increase venous return in the body. The first one is gravity. When you're dealing with blood returning from all parts of the body above the heart, then gravity is a huge help. It has a positive effect on venous return. If you're dealing with blood coming from your feet, then gravity is of no help. It is actually a hindrance. It has a negative effect on venous return. So here we have it. Gravity only helps with venous return of blood coming from areas above the heart. It also helps if you're doing yoga and you've got your feet elevated. When your feet are elevated, then gravity is a huge help, and blood can return to the heart fairly easily, thereby increasing venous return. As you can see in this picture, there's your yellow line showing venous return from the feet back to the heart, helped by gravity. The next factor that helps venous return is pressure gradient. This is a profoundly important factor because it helps the flow of anything: water, air, blood. In this case, we're talking about blood, and so the flow of blood is always from a region of high pressure to a region of low pressure. And we call this down the pressure gradient. We say that blood flows down the pressure gradient. So let's take a look at the movement of blood from the feet all the way to the heart. Yes, it's moving upwards towards the heart. However, in terms of pressure, it is moving from a region of high pressure in the feet to a region of low pressure in the heart, in the right atrium where it ends up. So let's trace the pressure changes from the feet all the way to the heart. P is for pressure in this flowchart. So the pressure in the venous plantar arch is greater than the pressure in the tibial vein. The pressure in the tibial vein is greater than the pressure in the popliteal vein, which is found at the back of the knee. The pressure in the popliteal vein is greater than the pressure in the femoral vein, which is in the thigh, going upwards. Pressure in the femoral vein is greater than the pressure in the external iliac vein, which is in the pelvic region. The pressure in the external iliac vein is greater than the pressure in the common iliac vein, which will now join the inferior vena cava. So the pressure in the common iliac vein is greater than the pressure in the inferior vena cava, which is a very long blood vessel, and the pressure in the inferior vena cava is greater than the pressure in the right atrium. So in this way, blood keeps flowing from a region of high pressure to a region of low pressure. The third factor is the skeletal muscle pump that helps to increase venous return. This factor has everything to do with exercise. When you exercise, your venous return increases and makes you feel a whole lot better. Whenever you exercise, your muscles contract. When they contract, they increase the blood flow up the leg towards the heart by squeezing against the neighboring blood vessels. So whenever you exercise, muscles contract and squeeze the veins, and that increases venous return back to the heart. So let's review that one more time. Whenever you exercise, your muscles will contract. The greater the exercise, the greater the contraction. The greater the movement, the greater the venous return. So your muscles, skeletal muscles contract. They squeeze against the neighboring blood vessels, which are veins, and these veins respond by pushing the blood upwards towards the heart. And this increases venous return, which is why when you are sitting on the aeroplane for long periods of time, you must do those exercises they tell you to do because it increases venous return. If you don't do that, you may have issues with blood clots in the vein. So you want to keep the blood constantly flowing and constantly have the blood moving upwards towards the heart. But remember, the blood always flows down the pressure gradient. I would like you to take a deep breath and exhale. You have just increased your venous return. We call this mechanism the respiratory pump because every time you take a deep breath, your diaphragm moves down and your rib cage moves out, and you create more space in your chest cavity. So in other words, your thoracic volume increases, and you know that when volume increases, pressure decreases. So your thoracic pressure decreases, allowing air to move in from the outside down the pressure gradient. What it also does is to increase your venous return. This is because the pressure gradient or the pressure difference between the abdominal IVC or inferior vena cava and the thoracic IVC has just increased. Every time you take a deep breath, the pressure in the abdominal IVC is greater than, much greater than, the pressure in the thoracic IVC because you have just decreased the pressure in your thoracic IVC so much more by taking a deep breath. This allows blood to move much more easily from the abdominal region to the thoracic region and into the right atrium. Not only have you increased the amount of oxygen that has reached your lungs by a deep inhalation, but you have also increased the venous return. Remember, increased venous return always makes you feel a whole lot better. So here's your take-home message. With every deep inhalation, you increase venous return. The last mechanism for increasing venous return has to do with the opening of the AV valves, the tricuspid and the bicuspid valves. We call this the cardiac suction pump. When the AV valves open, blood is sucked into the ventricles in a great force, and this creates a vacuum in the atria. And this vacuum allows to pull very strongly the blood from the inferior vena cava into the right atrium. We talk about the right atrium here and not the left atrium because blood coming back from the body is much more challenging than venous return coming back from the lungs, where it happens fairly easily. So whenever the AV valves open, blood is sucked into the ventricles. There's a sudden movement of blood into the ventricles. This creates a vacuum in the atria, and this vacuum allows more blood to be forced into the atria from the inferior vena cava and the pulmonary veins. But we are concerned with the inferior vena cava because venous return from the body is a lot more challenging.